Hello everyone. Today, we're diving into the world of a medication called Spinraza, scientifically known as nusinersen. As always, this discussion is for educational purposes. If you have health-related questions or concerns, always consult a medical professional. Description: Spinraza, or nusinersen, is a type of medication classified as an antisense oligonucleotide. It is primarily used to treat both children and adults diagnosed with spinal muscular atrophy, SMA, a specific type of motor neuron disease. SMA is an inherited disorder leading to skeletal muscle weakness and wasting, which progressively worsens over time. This condition is often caused by mutations in the SMN1 gene, resulting in insufficient functional SMN protein, essential for maintaining healthy motor neurons. Spinraza addresses this by ensuring the proper functioning of the protein produced by the SMN2 gene. The U.S. Food and Drug Administration, FDA, granted approval for Spinraza in 2016. Warnings: Spinraza can lead to serious side effects, including an increased risk of bleeding. Similar medications have shown complications related to heightened bleeding risks. Blood tests are typically conducted before starting Spinraza and before each dose to monitor for these risks. A heightened risk of kidney damage, including potential acute inflammation of the kidney. Similar medications have shown this increased risk. Urine tests are typically conducted before starting Spinraza and before each dose to monitor for these risks. Before taking this medicine. Before receiving Spinraza, inform your healthcare provider about all your medical conditions. Specifically, let them know if you have a bleeding disorder, have a kidney disorder, how it's administered. Spinraza is administered by a qualified healthcare professional in a treatment center. It's injected into the spinal fluid over 1 to 3 minutes. Before starting Spinraza and before each dose, blood and urine tests are conducted to monitor potential risks. The treatment begins with 4 initial loading doses, with the first 3 doses given at 14-day intervals and the 4th dose given 30 days after the 3rd dose. Maintenance doses are administered every 4 months. Side effects: Spinraza may cause serious side effects, including thrombocytopenia, coagulation abnormalities, and renal toxicity. Common side effects include lower respiratory infection, fever, constipation, headache, vomiting, back pain, post-lumbar puncture syndrome. Interactions: always inform your doctor about all the medicines, vitamins, and herbal supplements you're taking to prevent any adverse interactions. Dosage: the recommended dosage of Spinraza is 12 mg per administration. Treatment starts with 4 loading doses, with the first 3 doses given at 14-day intervals and the 4th dose 30 days after the 3rd dose. Maintenance doses are given once every 4 months. Avoid: while on Spinraza, it's essential to monitor for any signs of bleeding or kidney damage. Regular blood and urine tests are crucial. FAQ: Spinraza's mechanism of action involves altering the splicing of the SMN2 gene to increase functional SMN protein levels. It's used to treat spinal muscular atrophy, SMA, which leads to a decline in muscle strength over time in adults and children. The primary difference between Spinraza and other treatments like Zolgensma and Evrysdi is the method of administration and their mechanisms of action. Closing. That concludes our overview of Spinraza. Remember, this information is for educational purposes and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.